So how does CG deliver value? Well, we really have four arms within our services organization. So we have specialized staffing. So we have a large pool of experienced quality and compliance resources that we pull from and that we use and deploy at our clients. We also have a consulting arm, so we have a team of full-time employees that are all focused again on the validation, the design control, risk management, manufacturing space. And many labeling SMEs, right, that understand best practices when it comes to business process transformation. We also have technology solutions. So to accelerate the validation, accelerate data migration, we've developed AI domain-specific tools that help add to the existing solutions that our customers, whether it's Loftware or other software organizations, can use to, again, accelerate the implementation and help make validation easier. And then finally, we have OCM kind of embedded in all of these services, right? So we understand that anytime you introduce a new technology, there's going to be disruption. There's going to be this move from understanding what the change is to adopting the change long-term and sustaining the change. So CG has all of their resources certified in organizational change management and a large understanding of what that entails. All right, so yeah, as Carter alluded to earlier, the validation barrier is one of the biggest hurdles to implementing new technology across the board, right? But especially when it comes to digital labeling solutions. So back in 2016, the FDA met with the industry and they looked at all the different technologies that other industries were implementing, whether that's automotive, semiconductor, et cetera. And they were seeing that there was a lot of automation and data-centric tools and digital transformation that was happening. However, when they looked at the medical device and pharmaceutical industry, they saw a lot of hesitancy to adopt those tools. So what that meeting was meant to do is come together as an industry and identify what are the barriers to innovation, right? And what the FDA, they were anticipating that there was going to be challenges that weren't related to validation, but what they found out is that the industry kept saying that, hey, non-product software validation, CSV, is taking forever and costing us millions to implement new technologies, to go through these technology changes. So what the FDA did is the FDA said, okay, let's go back to the heart of what validation is all about. And make sure that what we're trying to do is be more lean, be more risk-based, and be more productive in our validation efforts. So the terminology that came out of that, as a marketing kind of vehicle to move this forward was computer software assurance, CSA. So, when you hear CSV versus CSA, a lot of the times we're talking about the same thing. But when we break it down in this perspective, what we're talking about really is the old school software validation approaches versus the new school software assurance approaches. So again, one of the biggest hurdles to our industry adopting these tools is the validation costs and really what that's all about. And so what I'm going to break down here is what are the differences between CSV and CSA. So for one, the focus in CSA, the new school approach, is to be quality oriented and to focus on risk-based approach to validation and critical thinking, not just documentation. So what we've found over the years is that we're creating many SDLC documents that weren't adding value just because we thought that's what we needed to do to be compliant, retesting everything. And what CSA is moving towards is, hey, let's look at the high process risk items and features, functions, and operations, and the things that are configured and customized for your organization. Let's test those things and let's leverage as much as we can from the vendor. From a risk assessment perspective, CSA, again, is getting down to that feature, function, operation level, and it really is the crux of the validation effort, where CSV, again, we did it, but it wasn't adding any value, and it was really just to check a box. From an adaptability perspective, CSV is very linear, it's rigid, and it's not really scalable across the organization, where CSA is taking into account agile approaches to software development, and it's very iterative, right? So continuous improvement is at the center and at the heart of CSA. I talked about the documentation not being value-driven, being more check of the box, being excessive and redundant, retesting everything, where CSA, again, is streamlined, again, focused on how do we validate this system? How do we ensure that we have confidence that it's working as intended? And using as much evidence that we can from what our vendors have done, what our internal IT folks have done, and using that towards the validation effort. From a technology perspective, CSA is looking to be digital and make it easy to digitalize, be more data centric in its approach, where CSV again is old school document focused. And then finally on the testing approach, which I'll talk a little bit about as we move on, and that we've done in our use case, is that it's on the CSV side, it's heavily scripted and manual. So there might be hundreds of pages of test scripts to test something that's already been tested, right? Versus CSA is introducing, new types of testing like experience-based testing, looking at day in the life scenarios, all different types of exploratory, error guessing types of unscripted testing to allow the business users to decide, okay, how do we prove that this functionality can be met? And how do we prove that, that there's not going to be a defect in this workflow or this particular process?